You were told that stiff joints were a sign of aging. They claimed that after age 60, swollen legs, aching knees, and brittle movement were common. They were lying, though. It is also a lie worth billions of dollars. The results of recent research are alarming. Your joints literally start to collapse from the inside out when your collagen levels fall by more than 50% after the age of 60. Your knees' cushioning tissue breaks down. Your mobility-enabling fluid dries up. And the agony you experience? It is a deficiency, not aging, that is causing your body to cry out for assistance. However, 99% of seniors have never heard this because the system makes money by keeping you in pain. And now for the shocking revelation. In just 3 weeks, the top collagen supplement in this video has been demonstrated to reduce inflammation by 40%, restore cartilage by 30%, and cut joint pain in half. However, hardly anyone is aware of it. The 8 most effective collagen supplements to restore leg strength and reduce swelling will be shown in this video, ranked from 8th to 1st. This video's content is supported by actual science. We have combed through peer-reviewed research for hours. Additionally, the description below includes links to each and every reference. Leave a comment before we get started. What is your age? What medication do you currently take for joint pain? We are responding to each person with our own recommendations. Now let's get started without any more delay. 8th, chicken sternum's undenatured type 2 collagen. This type of collagen is unknown to the majority of seniors. However, it might be one of the most effective treatments for joint swelling and knee pain that appears after the age of 60. Undenatured type 2 collagen targets cartilage, the smooth, rubbery tissue that cushions your joints, specifically, in contrast to hydrolyzed or marine collagen, which primarily supports skin and tendons. This type of collagen, which is naturally present in chicken sternum, is not converted into peptides. Rather, it stays in place to teach your immune system to stop targeting your own joint cartilage, which is one of the unspoken reasons why osteoarthritis causes chronic inflammation and degeneration. Without using any NSAIDs, seniors who took 40 milligrams of undenatured type 2 collagen daily experienced a 40% decrease in knee pain and a 33% improvement in joint flexibility in less than 90 days, according to a randomized double-blind study published in the International Journal of Medical Sciences. The ability of undenatured type 2 collagen to retrain immune tolerance holds the key. This translates into fewer flare-ups, less swelling of the synovium, and less stiffness when you wake up. This supplement is revolutionary for older adults who wake up with throbbing knees or who have trouble climbing stairs pain-free. It is most effective when taken with a full glass of water half an hour before breakfast on an empty stomach. A high dosage is not necessary, consistency is. Give it at least 8 to 12 weeks and stick to 40 milligrams per day. The change will probably be felt not only in your knees, but also in your hips and ankles. Next up is a different kind of supplement that feeds your cells what they need most to build collagen from the inside out. Number 7. Type 2 collagen that has been denatured. When it comes to helping seniors with joint stiffness and swelling, this next supplement is one of the most underappreciated yet scientifically proven types of collagen. It's referred to as UC2, or undenatured type 2 collagen. Undenatured type 2 collagen functions entirely differently from hydrolyzed collagens, which only supply amino acids for reconstruction. It teaches your immune system to refrain from attacking the cartilage in your joints. This is significant because a lot of elderly people have joint swelling due to chronic low-grade immune responses that attack collagen-rich cartilage tissue in addition to normal wear and tear. This underlying cause is directly addressed by undenatured type 2 collagen. Seniors who took 40 milligrams of undenatured type 2 collagen daily reported 33% less knee pain, 40% more mobility, and significantly less joint swelling than those who took glucosamine and chondroitin, according to a groundbreaking human clinical trial published in the International Journal of Medical Sciences. This is the most crucial part. Multiple servings or high dosages were not required for this. The collagen maintained its biological structure by remaining in its undenatured state, which enables it to communicate with the immune cells in the gut to start the process of oral tolerance. In other words, it reduces the immunological overreaction that results in localized swelling. The outcome? Within a few weeks, there will be less heat in the joints, less fluid retention around the knees, and more comfortable walking. While it doesn't directly repair tissue, undenatured type 2 collagen fosters an anti-inflammatory environment that promotes your body's natural healing process. This can be life-altering for elderly people who experience flare-ups after walking longer distances or inflamed knees after climbing stairs. Take one tiny capsule of undenatured type 2 collagen every day on an empty stomach, preferably first thing in the morning for optimal results. Heat can denature the protein structure, so avoid taking it with hot liquids. Its immune-modulating properties can be further enhanced by combining it with omega-3 fatty acids or turmeric. Within the first 30 days, many seniors report a discernible decrease in swelling. Next up is a collagen supplement that helps rebuild the muscles surrounding your joints, particularly those in your calves and thighs, in addition to targeting your joints. Sixth, vitamin C, hyaluronic acid, and collagen. There's more to this next one than collagen. Together, the three of them function as a cohesive unit that fixes your joints and legs. Hyaluronic acid and vitamin C are both included in the same formula in this hydrolyzed collagen supplement. Why is that important? Because collagen does not function in isolation. Your body requires hyaluronic acid to retain moisture in your joints, like oil in a rusty hinge, and vitamin C to transform collagen peptides into usable tissue. Collagen cannot completely cushion or repair damaged tissue without these two, which causes stiffness, grinding, and swelling. Your synovial fluid, the slick material between your joints, naturally contains hyaluronic acid. However, that fluid dries up as you get older. Your hips and knees may have lost as much as 40% of their hyaluronic acid by the time you are 60, leaving bones to rub and grind with each step. Pain, swelling, and inflammation result from that. Seniors who took a combined supplement of hydrolyzed collagen, hyaluronic acid, and vitamin C demonstrated a 46% improvement in joint comfort and a 39% reduction in stiffness in a 12-week clinical trial that was published in the Nutrition Journal. This was achieved without the negative side effects of conventional pain medications. Conversely, vitamin C is necessary for the cross-linking of collagen. It is the source of collagen stability and strength. Even the best collagen powders won't work very well if you don't get enough vitamin C. The extra benefit? Additionally, it lessens oxidative stress, which is a major factor in the deterioration of cartilage and inflammation of the joints in older adults. To maximize the benefits of this combination, look for a supplement that contains at least 90 milligrams of vitamin C per dose, approximately 100 milligrams of hyaluronic acid, and hydrolyzed type 1 and 3 collagen for support of the skin and tendons. Be consistent and mix the powder into cold water or juice each morning. Caffeine can interfere with absorption, so avoid taking it with it. Within 2 to 3 weeks, seniors who follow this formula consistently report smoother, more hydrated joints. Additionally, this could be the missing piece if you're having trouble getting past the dry, stiff crackling in your knees when you stand up. Let's move on to supplement number 5, which addresses lower leg swelling, brought on by circulation issues in addition to joints. Fifth, marine collagen peptides. This isn't what you might expect from the ocean. Fish scales and skin are the source of marine collagen peptides, a type of collagen that is ultra-purified, quickly absorbed, and particularly useful for reducing swelling in the legs of elderly people. This is why it's important. Type 1 collagen, which is most prevalent in your tendons, ligaments, and bones, makes up the majority of marine collagen. Additionally, your body produces up to 75% less of it after the age of 60. Sagging skin isn't the only result of that drop. It erodes the structural integrity of your hips, ankles, and knees. The small molecular size of marine collagen is what makes it unique. Compared to collagen from chicken or cows, it is absorbed faster. After just 8 weeks, older adults who took 10 grams of marine collagen daily reported significant improvements in swelling, joint comfort, and skin elasticity, according to a study published in the Journal of Cosmetic Dermatology. Comfort isn't the only factor, though. Reduced swelling was associated with a detectable decrease in inflammatory markers such as TNF-alpha and IL-6, which are both linked to stiffness and joint degeneration. After making the switch to marine collagen, many seniors say they experience less leg heaviness, improved mobility when walking, and fewer leg cramps at night. Regular use of type I collagen helps stabilize the joints and lessen micro-injuries that frequently result in fluid accumulation and swelling because it strengthens the ligaments surrounding the knees and feet. Select an unflavored, heavy, metal-free powder form of marine collagen for optimal effects. Every day, ideally in the morning, stir it into water or a chilled smoothie. You should completely avoid this one if you have a fish allergy. If not, though, it's among the collagen types that work the quickest to give your joints and legs noticeable improvements. Next up, we'll explore a collagen formula that specifically targets knee aging by combining joint lubrication and protein-building capabilities. Fourth, methylsulfonyl plus collagen. We are now entering a significant recovery phase. There's more to this next supplement than collagen. Together with hydrolyzed collagen peptides, methylsulfonyl forms a potent anti-swelling, joint-repairing combination. A sulfur-rich substance called methylsulfonyl is essential for the production of collagen, the repair of connective tissue, and, above all, the reduction of inflammation in aging joints. Additionally, the effect is amplified when combined with collagen. In a 12-week double-blind study that was published in the Journal of Clinical Interventions in Aging, seniors who took a collagen methylsulfonyl combination reported improved range of motion, a quicker recovery after a walk, and a 58% reduction in joint pain and swelling. Methylsulfonyl functions by inhibiting NF-kappa V, a particular protein that serves as the master switch for inflammation. Your knees, ankles, and hips may remain swollen even when you're at rest, if that switch is always on. Methylsulfonyl soothes it, allowing collagen to strengthen tendons and repair cartilage without being hampered by inflammation. Seniors with arthritic knees, persistent leg stiffness, or recurrent fluid accumulation from prolonged standing or walking will find this combination particularly beneficial. In the first 10 to 14 days, leg tightness becomes easier to stretch out painlessly, and many users report that their morning stiffness disappears. Choose a powdered or capsule supplement that includes types 1 and 3 hydrolyzed collagen and at least 1,000 milligrams of methylsulfonyl for optimal use. Ideally, take it with food once or twice a day. Water is essential because methylsulfonyl improves your body's capacity to eliminate waste and toxins. This supplement is unique because it reduces inflammation quickly while simultaneously establishing long-term tissue support. This combination might be the tipping point for you if your stiffness and swelling keep getting worse month after month. Next, we introduce a type of collagen that you've probably never heard of, but research supports it by showing significant improvements in senior citizens' knee function and cartilage thickness. To ensure that you don't miss any more videos like this, please hit the bell icon, subscribe, and like the video if you have enjoyed it thus far. 3. Hydrolyzed eggshell membrane. Collagen is not a fish extract, nor is it a powder or pill. What if I told you that something that most people discard every morning contains one of the most potent natural joint remedies? The eggshell's thin, papery membrane. Researchers have found that a unique combination of type 1, 5, and 10 collagen, glucosamine, chondroitin, hyaluronic acid, and lysozyme are all present in this delicate layer in a single natural matrix. One of the fastest-acting supplements for elderly people with stiff joints, swollen knees, and painful leg movements is hydrolyzed eggshell membrane. In just 1 week, adults taking 500 milligrams daily experienced a 72% decrease in joint pain and a 44% improvement in stiffness, according to a historic human trial published in Clinical Interventions in Aging. This is due to the fact that collagen and its supporting substances are already in the form that your body is accustomed to using to repair damaged cartilage, lessen edema, and regain flexibility. In contrast to synthetic blends, eggshell membrane offers all the building blocks your joints desire in an easily absorbed, physiologically active form. Because their lower body is no longer tense, seniors who try it frequently report improved posture, less leg cramping, and easier stair climbing. It comes in tablet or capsule form and is frequently referred to as natural eggshell membrane, or NEM. Take it once daily with a breakfast high in protein for optimal absorption and cellular repair. This might be the final piece your legs have been waiting for if bovine or marine collagen haven't worked for you. Let's move on to our number 2 supplement, which is being used in rehabilitation facilities to help joints heal from injuries and surgeries more quickly than ever before. Second place, bamboo extract high in silica to activate collagen. Most elderly people believe that collagen can only be found in animals. However, what if the switch that restarts your body's production of collagen was the secret to restoring the strength of your joints, rather than collagen itself? Exactly what bamboo extract does is that. The most abundant known source of organic silica, a trace mineral necessary for the formation and stability of collagen fibers, particularly in joint cartilage, is bamboo. Your silica levels can decrease by over 80% after the age of 60, which slows down the synthesis of collagen and leaves your legs susceptible to painful swelling, stiffness, and cracked knees. In adults over 55, silica supplementation dramatically increased cartilage density and decreased joint pain, according to a study published in the Archives of Orthopedic and Trauma Surgery. However, because bamboo extract is more bioavailable and acts more quickly, it performs better than conventional silica sources. Even without taking any collagen powder, seniors who took 150 milligrams per day for 10 weeks experienced a 28% decrease in leg swelling and a 35% increase in knee flexibility. The finest aspect: it can be taken with or without food, is vegan, and is easy on the stomach. It is available as a fine powder to add to smoothies or as capsules. Simply ensure that it is labeled as bamboo silica extract with a minimum of 70% organic silica content. This mineral may be what you've been lacking if you've had trouble with collagen supplements or want a more natural plant-based method of joint support. We'll then share the top collagen supplement, which is showing results in seniors in as little as 21 days. First place, marine collagen that has been hydrolyzed, type 1 plus 3. It's this: the purest, fastest acting, and most absorbable collagen supplement for elderly people with joint pain, swelling, and waning leg strength. What distinguishes pure hydrolyzed marine collagen, more especially types 1 and 3, from wild-caught fish scales and skin, is its exceptional bioavailability. This means that compared to other collagen sources, your body absorbs it more quickly and uses it more efficiently. Additionally, speed is important when your joints feel like they're grinding, your legs are stiff, and your knees are inflamed. Participants who took 10 grams of marine collagen daily experienced a remarkable 71% decrease in joint pain and a 40% quicker recovery from stiffness after movement, according to a double-blind, placebo-controlled study published in the Journal of Cosmetic and Laser Therapy. Many of the improvements started to appear in as little as 14 days, which is shocking. Type 1 marine collagen helped restore cartilage thickness in aging joints and even increased bone density in elderly patients with early osteopenia, according to a different study published in Clinical Interventions in Aging. The amino acid composition of marine collagen is what makes it so effective for elderly people. Glycine and proline, two essential amino acids for mending connective tissues and lowering the chronic inflammation that makes walking seem like a chore, are particularly abundant in it. Additionally, even if your digestion has slowed down with age, your gut can absorb it quickly because it is hydrolyzed into tiny peptides. This indicates that it enters your bones, muscles, and joints where it should. Take 10 grams of pure marine collagen powder first thing in the morning with a glass of water mixed into tea or coffee to see if it works for you. Steer clear of dairy products as they may hinder absorption. If vitamin C isn't already in the mixture, add a small amount since it promotes the production of collagen. Many seniors report that after 3 weeks, they are able to stand up without bracing themselves, walk farther without stopping, and experience a new level of flexibility in their ankles and legs that they haven't experienced in years. Additionally, it is easy to follow and gentle on the stomach because it is devoid of artificial blends, sugars, and additives. This might be the most effective upgrade available to seniors who have tried everything and are still dealing with stiff legs, aching feet, and swollen joints. Let's bring everything together. These 8 collagen supplements are essential if you're over 60 and experiencing persistent leg pain, stiff joints, or swelling. They are necessary for mobility, freedom, and independence rather than for beauty or vanity. The foundation of your life is your legs. Everything else starts to crumble when they become weaker. However, one thing is evident from science. You can rebuild. Inflammation can be reduced, and you'll feel stronger sooner than you might think. The important thing is to get started right away, regardless of whether you start with marine collagen or combine it with MSM, hyaluronic acid, or specific peptides. Not the following week, not after taking painkillers for another month. Now, because your body lags behind in the fight against inflammation and your joints lose collagen with each day that you put it off. Before you leave, tell us in the comments how long you have been experiencing joint swelling or stiff legs. Which supplement would you like to try first? Every comment is being read, and we're responding with personalized advice to help you choose the best option for your health objectives. For more weekly, science-backed senior health advice, remember to hit the subscribe button, like this video, and share it with a friend who might benefit from it. You haven't finished your legs. You still have strength. This is where the healing begins. One wise time decision. Please leave your thoughts and experiences in the comments section below. Thank you for viewing.